This is a ward treating Alzheimer's patients in a place you probably don't expect, behind the walls of an Arizona prison. The men, many in their 70s, 80s, and beyond, are in beds and wheelchairs. And this illustrates an alarming and expensive trend in our prisons, the aging of the inmate population.
The number of people in their 50s, 60s, 70s, and beyond, and the healthcare issues that come with that, is really coming at us fast.
What are we walking into here?
So you're walking into an inpatient center.
Arizona Department of Corrections, Rehabilitation, and Reentry Director Dr. Ryan Thornell took us on a tour of the prison medical facility in Tucson. It's the largest in our system. What we saw was a significant number of elderly men being treated in a hospital-type setting.
When you think about an inmate population, you're probably not thinking about a 75 or 80-year-old guy.
Right, yeah.
But you've got a lot of them.
25 or 30-year-old who's coming in that you read about on the news or something of that nature. That's who you see coming into prison if you're a member of the public. But many of these people maybe came in when they were 25 or 30, but they're here the rest of their life.
Just like outside prison walls, as people age, they need more medical care. The Arizona Department of Corrections is in the middle of a decade-long lawsuit saying they're not doing enough to medically care for inmates. The staff here, though, disagrees, saying they've made major improvements in the past couple of years, pointing out that inmates are taken off prison grounds for visits to specialists when needed, and doctors work behind prison walls to make sure their needs are met.
I'd say for the average working class person, I think they would be very satisfied if they had the same medical care and treatment that the average inmate in our population receives.
There are areas where there have been improvements, but there are also problems that are so profound and so deep that have not yet been addressed.
Corrine Kendrick is a prison policy leader for the ACLU, which is part of this lawsuit. She says expert evidence shows, for example, that it can often take too long for an inmate to be seen by a specialist.
What do you say to people who say, why should people inside prison walls who've committed crimes have access to health care that's as good or better than I have?
The first response is, the fact that incarcerated people have a legal right to minimally adequate health care. That is bedrock under the 8th Amendment and under a large body of case law. The fact that people in the United States do not have a basic fundamental right to minimally adequate health care is obviously a much broader issue with American society than we can address in this case.
The lawsuit could come to an end at any time. But Dr. Thornell says no matter what the outcome, a simple fact will remain.
Corrections wasn't designed to have a population with this level of health care need.
But as that population ages, that's what we've got. The director says the state just gave his department $100 million specifically for inmate medical care, and more staff are being hired. The lawsuit's in its final stages. We could get a ruling from the judge in just weeks. Now, the judge could let corrections continue the path it's on now, or could appoint an outsider to run our prison healthcare system. So it's a complex issue. If you're interested in more information, I've placed uncut interviews with both the prison director and the ACLU co-chair of the National Prison Project on our 12+ streaming app. So go to the Troy Hayden Reports section to see this and other in-depth Arizona stories.